Hello, Sarah here from the Centre for Mental Health. I hope all is well. We had a big announcement this week from the Chancellor about the investment into mental health over the coming years. And I thought it would be a good idea to have a few words about that today, just to kind of break it down a bit and for us to share with you some of our thoughts about the news. I mean, I think it's the first thing to say is that, of course, we welcome any investment into mental health. For us, campaigning for parity of esteem for many years, it's a great relief to see that the NHS and certainly the Chancellor, the Treasury, is absolutely accepting that to achieve parity of esteem, we absolutely must make sure that mental health has a fair share of the budget for the NHS going forward. It has a share, whether it's a fair share is another matter. Certainly for many working in the system, 2 billion is a lot, but they would question whether it's enough. We certainly welcome the investment into crisis care. We know for too long people have found themselves in crisis and found themselves alone, not being able to get the help when they needed it most, or finding themselves in A&E frightened and worried and anxious, or worst case scenario, in the criminal justice system, being picked up, being in a cell. All of these things are unacceptable, and developing crisis care across the country absolutely should be a priority. And we welcome that investment, and we hope that the interventions will be well evidenced so that we can use the money to the absolute best. We also want to know about how we can prevent crisis. So whilst this investment is absolutely about services, we want to know what about welfare advice, housing advice, prevention, all of these aspects that certainly have experienced the most cuts in recent years. We also welcome the investment and pledge to increase and expand the role of individual placement support in the aim of getting people who have serious mental illness into work. For many people who want to work, their illness has often been an obstacle. Individual placement support offers a way in which we can kind of navigate the system in a way that sustains people in jobs. We know that there are some people for which employment is out of their reach, and absolutely we therefore are concerned about the impact of universal credit and other benefit sanctions. And therefore we're saying again the same message as we've always said, that to preserve good mental health, the investment needs to be into the system, not just one part of the system. Social care, education, criminal justice, all of these things come together to ensure that we can give people the care that they need at the right time in the right place, that we can divert them out of criminal justice if they find themselves there, that we can ensure that people with serious mental illness also get their physical health needs met. So we're keen to know a bit more about the detail here. What is going to be the mental health emphasis across the entire NHS plan? You can't look at long-term conditions without thinking about what is the mental health implications of this. So we're close. We're closer than we've ever been. But many of us would say so much still needs to be done. The investment isn't quite there yet. There's so many parts of the system that aren't included in the recipe that we were given on Monday. And we're saying that the recipe is a big one, and one that absolutely can come together, and there is evidence of this around the country. So we want to see the detail, and we'll keep you informed of the progress. Of course, it's difficult times. Austerity is not over for the entire system yet, and we look forward to that day, certainly.